Thanks everyone for joining the second series of second part of our knowledge series. Okay, great. Gopal, thank you for letting me know that you can hear me. I'm in and out of connection for some reason. Neil, can you hear me? Can you take this up, Neil?
Yes, I can. Yes,
I have a bad connection, it seems.
No, I can hear you, Nancy.
Okay.
We can hear you now.
Right, perfect. So today we have some very accomplished people with us to talk about mental health. We have Ms. Melissa Hardy, Director of Social Work, Clinical Practices and Education from Genesis US. We have Dr. Jayashree Gupta, who is a PhD from NIMHANS, and I think a lot of you people know her already. She's also the co-founder and project director for Samvedna, along with Archana. Then we also have Dr. Rao, Dr. Nirmala Rao, who runs a psychiatric clinic in Bombay, and she's joined us as well today. The sessions will be led by Melissa and Jayashree. The format is interactive. We want to hear from you. We want to hear what you have to say about each thing, about each of your practices that you're running. The way we will run this is once Melissa completes her thoughts, because she'll be the first one to go, we will have an interactive 15-minute conversation where you can either raise your hand and Catherine will unmute you, or you can type the question on the chat. Post that 15-minute conversation, Jayashree will come on to talk about mental health in a home care setting. And Melissa, of course, is going to talk about mental health in an institutionalized setting. So I'm just going to hand this over to Melissa.
Thank you, Nanki. Good morning from here, but good afternoon to you. Thank you for that introduction. Let me just share my screen. Give me 1 second. Okay, so thank you for having me this afternoon. My name is Melissa, and I am the Director of Social Work, Clinical Practice, and Education at Genesis US. Today I'm going to talk about some of the lessons that we've learned from a social work standpoint regarding the coronavirus in our nursing homes. So I'm going to talk a little bit about what we're doing or did to prepare, and some things that we did while we have the coronavirus in our centers and our institutionalized settings. So doing preparation before you have a patient or staff member test positive for COVID-19 will save you time and frustration if an outbreak occurs. So you'll want to restrict all visitation to the center. This can be a very difficult process for families and loved ones to accept and understand. However, keeping the number of people that visit the center to just the necessary key staff it helps us keep our patients and our staff safe. So what we did to prepare for that is we prepared signage to be available to post on the center doors, and prepared other forms of communication, such as telephone, developing a telephone tree conversation. And the exception to that restricted visitation was that during some of our patients' end-of-life care, if their families wanted to be with them during end-of-life, we allowed them to come in the center and do that with them. Another task that we are mandating is for all staff to ensure that all patients and families' contact information and demographic information is accurate, including an email address. So email allows us to disperse information commonly and quickly to all of our family members. And additionally, we want to educate staff and family members and the patients about what the facility is doing to prevent COVID-19 and its spread. So it's important for our leadership to listen and recognize the fears of staff, fears of our patients and families, and reassure them they will make it through this together as a team. Also, during the preparation stage, we developed and prepared talking points for staff to use to contact families in case of an outbreak. So by using structured talking points, we can ensure that accurate and complete information is being communicated when an outbreak occurs. During this preparation stage, leadership should assist department heads to develop staff contingency plans in the anticipation that some staff will be COVID-19 positive and need to quarantine themselves. So we want to think about who you have in your center that could perform other duties. So for example, if you have a former nursing aide that is now working in the recreation department, you want to make sure we leverage their skills as a nursing aide and a recreation assistant to maximize their skill set for our patients. You want to establish with your mental health and hospice service providers what their telemedicine capabilities are. Do they have the proper technology to perform visits remotely? Also, you want to consider assigning someone from your team to be the technology lead to coordinate and assist with telemedicine visits. If your providers do not have telemedicine capabilities, do they have one person who could be consistent to come into the center to provide and be assigned only to your center? Also in the preparation stage, we want to consider the patient's overall goals of care and end-of-life preferences. The team, including the medical provider, the nursing staff, and the social worker, should plan to partner for goals of care conversations with patients and their families. We want to review their current end-of-life preferences that have already been established and update medical documents and orders as necessary. We also want to engage with our palliative care and hospice professionals, determine their telemedicine and staffing capabilities, and develop a plan to use their services to discuss goals and patients with our families. Finally, during the preparation stage, we want to make sure we have enough technology. So we want to gather laptops, tablets, and other portable devices that can be used for video conferencing communication with healthcare professionals and patients' loved ones. We want to familiarize staff and families with technology applications such as Zoom or FaceTime for family communication. And we want to educate staff on proper infection control protocol and cleaning supplies available for electronic devices. Now, during an outbreak, social workers focus on identifying and addressing psychosocial concerns and social isolation symptoms experienced by residents and or reported by their loved ones. We need to explore the patient's fears and feelings, such as maybe feeling scared about being infected or possibly dying, being socially isolated and or excluded, being powerless in protecting their loved ones who are still in the community, losing loved ones due to COVID-19, feelings of helplessness, boredom, and loneliness. This could be a triggering event for people who have had a past crisis or trauma experience. So this may trigger them to relive that past crisis. And having a heightened awareness and sensitivity to their other comorbid problems that could be mistaken for COVID-19, such as seasonal allergies, the common cold, or influenza. So social workers need to stay engaged with our mental health and behavioral health service providers and offer alternative communication strategies such as telemedicine for our patients. We want to continue to individualize care plan interventions based on person-centered needs, and these interventions may change during the outbreak. As we reviewed earlier, we want to assess for changes in the patient's mood or behavior. And what can we do as staff to engage our patients that are now isolated? A suggestion would be to have patients avoid excessive exposure to media updates related to COVID-19, as this could increase their anxiety. We want to have clear communication with the patient and family about their medical status, not what they're seeing on the news or on social media. We want to collaborate with our recreation department to make the patient have self-directed activity materials available and accessible during all shifts. So we want to empower our patients to maintain choice and autonomy as much as possible during their routines. All staff, including social workers, need to validate the fears of patients and their loved ones. We need to reassure them that all measures are in place to keep the patients, staff, and families safe. We want to use and distribute to families and staff members information about COVID-19 from credible sources such as the World Health Organization or the Centers for Disease Control and Prevention. We want to identify and educate on why there are various types of personal protective equipment that we're wearing and why and when they are being utilized. We need to consistently provide regular updates to patients and families, keeping the lines of communication clear and open. Some suggestions would be to facilitate daily virtual family meetings to review the outbreak status of the center, but obviously not to speak about specific patient information. We can send them email updates and encouraging family members and loved ones to use alternative ways to communicate. We want to have a plan in place to effectively communicate with families that could benefit from enhanced communication. So some of the ideas that we've had is, and in some of our centers, the patients all live on the first floor. So some of the family members are visiting with their loved ones through the window being closed, but at least having eyes on their loved one and the patient seeing their loved one decreases the anxiety of our patients and families. Also, we want to consider ensuring that we're using the language translation services if needed to convey any of this important information in the patient's and or family members' preferred language. So I want to spend my last few minutes talking about caring for our patients with dementia during this COVID-19 pandemic. So given impairments with memory, language, learned motor skills, and perception, residents with dementia are profoundly impacted by the changes in daily routine, environmental changes, group activity restrictions, the lack of familiar visitors, the increased use of our PPE, staff shortages, and the overall emotional tone in our care settings. So there's no easy answers, but we have a few suggestions that may help. Since it is necessary to wear PPE when caring for our residents, try a simple explanation that these items are needed right now to keep everyone healthy. As you're entering into their personal space, let them know what you will be doing. Briefly explain why we have to put PPE on and not just put this mask on. Reassure them by saying, see, we're all wearing them. Ensure that the staff name badges are visible and using the patient's preferred name, and explain what we're doing. While they can't see the smile behind the mask, your caring manner will still shine through your eyes and compassion during your interaction. We want to use the patient's life story to engage in conversations about such things as their family, their hobbies, prior occupations, and pets, so that they know you're familiar with them and that you're not a stranger. We want to make sure we establish that connection. We also want to be aware of our nonverbal communication. For residents with dementia who have difficulty remembering and processing verbal and written instructions, We need to consider our tone, behavior, and body language when communicating to these residents. If we are constantly fearful and frustrated, these nonverbal displays of emotions will be communicated to them. It's common for residents to reflect back on the emotions they see in the staff and will do so in some form of increased behavioral symptoms, such as increased agitation, resistance to care, and motor restlessness. Even though we may feel stressed and anxious, we need to use our best acting talents to remain calm while interacting with our patients, especially our patients with dementia. We want to keep the care in our care interactions. With communal activities restricted in our care setting, the only social interactions some residents may receive involve care activities, so providing ADL care, one-on-one recreational engagement, mobility assistance, and medication administration. We want to avoid overstimulating conversations, doing activities for the resident that they can help with themselves and with through rushing care tasks. So we want to consider using a simulated presence. So residents with dementia often need repeated and reassurance when they are worried. So maybe a phone call or a video conference a few times a week may not be sufficient for these residents. Simulated presence involves playing an individualized video or audio recording of family members or friends for the resident with dementia to see and listen when he or she is worried or in need of reassurance. So some examples of that include recording reassurance that family is safe and well. We want to encourage the resident to participate in the care activity. We want to have family members maybe record a message about reminders about how important it is for our residents to eat their meals. Maybe a recorded message encouraging their loved one to wash their hands. So these recorded messages on their phones or send links to staff to try to use with the patient. While this technique may not work for every resident with dementia or every time it's used with a resident with dementia, it's another option to consider. So consistency is key. So many things may be different. Try to keep some things as routine and consistent as possible. So consistent staffing and caregiving routines, times for activities of daily living may help keep some of things familiar. And since meals will be in the residents' rooms, keeping preferred meal times, providing favorite food choices, and familiar music may help. We also want to validate the individual's concerns. So we want to focus on the feelings, not necessarily the content of what's being said. Sometimes the emotions are more important than what is being said. Look for the feelings behind the words, and we want to affirm the person's feelings that may help them calm down. So in closing, what we've learned through our COVID-19 pandemic is that we cannot over-communicate with patients, families, or staff. And as social workers, we hold a critical role in providing information to and from the center and the patients and their families. We need to be there to help our patients and families cope during this pandemic. So that is the end of my presentation. So I think we can stop and have some time for questions.
Great, thank you. So as you are coming up with questions, you can use the raise your hand feature, and I will allow you to talk, and you can ask your question directly to Melissa.
While we're waiting for some questions, Kate, one thing that I just would like to emphasize to everyone is that, social services and mental health we've always worked with family members, but we've really focused a lot on the residents within the centers. I think as we're going through this process, one of the things that we've really learned is that we have to be extremely transparent with the family members, that we're always talking with the family, we're always letting them know exactly what's happening in the buildings. One of the things that we've learned from some of the other buildings, non-Genesis buildings out there, is that when COVID does come into your building, that it's very important that you're keeping the family members in the loop of exactly what is happening. Not being transparent and not letting the family members know what's happening in the building allows them to generate additional fear, generate additional anxiety, and sometimes lash out at the building. So we've very much learned is as soon as something happens in the building, we have to be very, very upfront, and we have to make sure that we're communicating with family members of what's going on. That includes how many residents in the building may have COVID, how many staff members in the building may have COVID, what we're doing in terms of our communication with local authorities, with Department of Public Health, with the mayors, with local government. It's very, very important to always be having consistent, transparent communication with those family members. It helps ease that anxiety and allows those family members to feel like they're part of what's happening instead of being excluded. So I really want to stress that point. In most situations, it's not if COVID is going to get into your buildings, but really when COVID, especially in the United States right now, because we have so many cases, but it's when COVID is going to get into your buildings and how you're preparing for that.
Yeah, also, Neil, I think what we experienced is, there's obviously a lot of media presence when it comes to COVID. So you don't want your family members or your staff or your patients to hear that you have COVID in your building from the local news. We want to share it as soon as we have that information. We want to relay what we're doing to prevent the spread, how we're screening staff and anyone who may be coming into the center. It's very important. And we learned that lesson real quick from hearing other centers and other companies that have had an outbreak. I see a question. How do you feel with how do you deal with the anxiety of staff? It is a real fear for our staff. Some of our staff could be older and have some other comorbidities themselves. Some staff have family members that they go home to and they're afraid for their health. So it's really talking through their fears and acknowledging their fears of COVID and what we're doing to prevent the spread. So making sure that we're rounding on a consistent basis to make sure every staff member is wearing the proper protective equipment, that we have enough of that equipment for every staff member to have it when needed, and to have that equipment right on the unit that the person's working. But I think you do have to address and validate those fears, because it is scary. It's a new thing. It's a new disease process for us that we don't have a lot of experience in. But I think regularly holding staff meetings, sharing the numbers with the staff, as well as what Neil talked about, sharing with the families and the residents, and being transparent. What we have in Genesis, we have probably 4 or 5 calls a week that's opened up from our corporate offices, open to every center, every employee, that they can get on to kind of give a status update of what's happening today, what's changed or updated, and it allows direct staff members to ask questions and have them be answered by our leadership. So being transparent with the staff that way too.
Hi, Kate, this is Dean. Good morning, everybody. Good afternoon as well. My name is Dean Fike. I'm the Senior Vice President of International Operations, and I just want to add something to Neil's comment and to Melissa's comment. One of the other things that our company has done is to make sure that we are giving advice to our frontline staff, every single staff member, whether it's social service, whether it's environmental, everyone, in all of our centers, of not only how to protect themselves while they're at work, but how do you protect yourself and your family because you work in a healthcare environment. So there are certain things, I know it went out, I think last week, Thursday or Friday, in what do you do before you come to the building, before you come to the community, what do you do to protect yourself and your family once you leave the building before you get into your house? We do not want any of our staff to sort of take something back home. We really need to protect every single person that either enters or exit our building, but also protect, the people that are very near and dear to our hearts, that provide that direct care to all the residents in our centers and non-direct care. We need to protect them as well, and that's very, very important to us.
Thank you, Dean. I did see somebody raise their hand, and if you do still have a question, please do it again and we can allow you to talk. There is a couple more questions that have come through the chat. So one of them is, how effective are online communication tools as against personal interaction? And what are your thoughts on that?
Yeah, I think that's a great question. I think we all know kind of who our high-touch family members are. Some family members want to be, interacted with moment to moment on what's going on. Some family members just want a quick email update every couple of days on their patients. So I think either way works. I think definitely personal interactions, not only with, what may be happening with COVID, but maybe what their loved one did during that day is very helpful to know for families. So it's not necessarily just communicating bad information. It could be communicating that, they wrote a letter to their family member, or they received your card that they sent you, or, that they finished a puzzle and here's a picture of it with the patient. So it's really knowing your families and knowing how they want to be communicated with. But certainly if you need to get information out quickly, the online communication is very helpful. We do hold, family meetings via Zoom, just like this technology. So having a good moderator when you're facilitating these meetings to make sure, we're not talking about personal or patient information, but also to keep the tone of the conversation not in a fear or an anger-based way. So we want to answer questions as well as we can, but also temper some folks that may have some anxiety about their loved ones during this process.
Hey, Kate and Melissa, I just want to actually add something. I'm living this firsthand with our mother, who is actually in one of our Genesis centers. And one of the things that they have done very effectively is, to Melissa's point, you can either do a one-on-one with someone in the center, or they have, what we have now is, it's every Tuesdays and Thursdays, I think, where we have the opportunity as family members to get on a Zoom call, and the executive director, the center executive director, as well as this chief nursing executive, actually will be on the call to give us an update. But it's all the families, so we can see all the families at one time. All the families have the opportunity, just like you do today, to sort of send in their questions and ask questions. You can either participate in that, or you can actually do sort of a one-on-one. I found that that's probably one of the best things that we've done as a company, is to actually give everybody the opportunity to either choose one or the other. There are a lot of people that really love sort of seeing everybody else's family members who are experiencing the same thing, whether it's that anxiety, not knowing what's going on, that sort of that loss of not being able to see them or touch them or talk to them. There was one story last Thursday that I think made probably, I would say 80% of the people on that video chat cry. Just about something that someone did a face-to-face with their loved one, and that said, oh, that's my baby. And her son is like 60 years old, but that just made his day and made everybody else understand how real this is, but how transparent all of us need to be to tell the truth, whether the truth is positive or it's something that happened.
Thank you. And I did see Colonel Sridharan. I'm going to let you talk now as you raised your hand.
Thank you. And good morning to everybody. Can you hear me?
Yeah.
You know, I've been learning a lot from the webinars conducted by Genesis, and I'm very grateful to you in the first place. I just want to tell you, sharing your experiences and sharing our experiences in India. Yeah, of course, we are no match to the kind of facilities that you have in the US. But one thing I notice in our facilities, which are both horizontally spread over a couple of acres, let us say 15 to 17 acres, and some facilities which are in apartment blocks, raised apartment blocks, in house in 1 or 2 or 3 blocks of apartments. I personally feel that because of the interactive lifestyle that the residents have, their freedom, maintaining that physical distance from each other, and their ability to converse and see, meet, and of course aided by the technology with which they can even meet and speak to their loved ones, and also the telemedicine facilities that we are able to offer in whatever small form that we can. I think the future projects perhaps could be more spread out than being hooked up in a single block of apartments, be it for the senior living or even the care components, because I think if you see more space around you, perhaps psychologically you may be in a better position. What would you like to say to that, please? Thank you.
I think that's a great point, you know, and our centers are set up differently as well. Some of them are more of a, like you said, an apartment block or a high rise where we have multiple levels of patient care areas, and some of our centers are on one floor. So all the patient care areas are on one floor. For the ones that are on one floor, some of the centers have individually marked their loved ones' windows, so they know what window they could go to physically see their loved one without having to go into the center or risking exposure to our patient staff and themselves. So we've seen a lot of stories where, you know, they're looking through the window to each other, you know, touching their hands together on the window just to make that social connection. We've also established some talking points and guidelines in, you know, taking patients outside. You know, we still have to follow our social distancing policies. We still have to have all the protective equipment on the staff and the residents, but it's really hard for them to be sitting in their room. I don't even know how many weeks now this has been going on, 4 or 5 weeks, I'm guessing, you know, to be limited to that one area. So those are some of the considerations that we've had, but I think, you know, the use of technology cannot be overlooked when you know, when you see a face-to-face interaction over Zoom or over FaceTime with your loved ones, you know, it really helps the family's anxiety see that, okay, they're there, they're being taken care of, and I can hear from them. So those are some of the things that we've put into place.
Thank you.
Great.
Thank you very much.
Thank you very much. Yeah, thank you for your question. We are going to go over to Josh's presentation now, and there are still more questions coming through. So hopefully at the end, we'll get to go through those questions in the chat. So Joshri, if you want to start your presentation.
Great. Would you like me to just share my screen?
Yes, please.
Are you able to see my screen?
Perfect.
Great.
Thank you.
Well, at the outset, I'd like to really thank Genesis for this opportunity to really share our experiences at Samvedna as a healthcare provider. So thanks a lot to Nanki and Neil and your team for this opportunity. I'm a neuropsychologist and the co-founder of Samvedna Senior Care. And we focus quite broadly on senior citizens across the spectrum. So we work right from active aging to interventions with seniors for mental health conditions, as well as provision of home-based services for seniors with chronic illnesses such as dementia and cancer support. So given that background, I mean, I think my talk's going to be a little broader, and I'd really like to anchor this in terms of how the COVID-19 situation has really impacted seniors in all these areas, and the way in which it's important to think about the mental health of seniors at this time, and touch upon some of the things that we're doing at Samvedna to support the mental health of seniors. So just to begin with something that I'm sure all of you already know, but it's really important to emphasize, is that seniors are more susceptible to the risk of COVID-19, and the reasons for this are primarily that with an increase in age, immunity decreases, but also because people above the age of 60 are more likely to have risk factors such as diabetes or heart disease and asthma, all of which are additional risk factors for COVID-19. But that's one of the reasons why it's very important to ensure that they're not only safe, but given the lockdown measures that have been implemented across the last couple of weeks, this group of individuals are also vulnerable to mental health related issues. And I'd like to talk a little bit more about how different groups of individuals are being impacted in different ways. So over the past few weeks, we've been receiving calls from different elderly who've been experiencing challenges, some of which are unique to certain groups of individuals and some of which are common across different groups of individuals. So firstly, there are those seniors who are living with their family members. And for many, this lockdown is actually a great time where they're able to spend more time with their family members, they're able to spend more time with their grandchildren. But for many others, who particularly those family members who are caring for a loved one with a chronic illness, this has become a struggle, particularly because they don't have the kind of support that they used to have prior to the lockdown situation. And then there are those seniors who are living alone. And these are seniors who are independent, either living alone or with their spouse, and managing fairly well. But then with this lockdown situation and the restrictions to travel of support staff to help them with daily activities such as cooking and cleaning, these individuals are struggling because they're having to manage all of this more independently without the kind of support that they used to have previously. And also, a lot of these individuals, although they live alone, live fairly close by to other family members. And what these restrictions mean is that family members are no longer able to physically go and meet them, check in on them, and provide the kind of support that they used to. And particularly when we're talking about the mental health needs and requirements of this age group and of this particular group of individuals, it's important to remember that these are individuals who we were encouraging to remain independent, who we were encouraging to remain active and healthy. And this lockdown has really impacted their independence and autonomy. So it's important to think about, talking about their mental health needs while thinking about how we can do that and maintaining their dignity and autonomy. And then, of course, there's a group of individuals who have been caught unaware by this entire situation. We know of many seniors who had gone to receive medical treatment of some sort, been caught down by the lockdown, or even seniors who were perhaps living alone or with family members have gone to visit relatives and now unable to travel back because of the travel restrictions. We know of spouses who have, one of whom has gone to visit maybe grandchildren and now no longer able to travel back. And these are circumstances which are very uncertain because with the travel restrictions and not knowing when the situation is going to change, these group of seniors are now feeling more uncertain about what they can do. And this is particularly a group, that I'm personally, I can relate with, since this is something that I'm dealing with my own parents as well. And of course, there's those seniors who are in institutional care that Melissa's already spoken about. But at a broad level, the way that I think most senior citizens have been struggling the maximum, and something which I think a lot of us are also struggling with as well, is how do we manage the daily routine? With the reduce in support that these current circumstances mean, many seniors are struggling for the basic daily needs. They're struggling to support, manage the household, manage basic groceries, manage their medications. And these are some of the challenges that they're having to deal with on a daily basis with reduced support. And what this is impacting, how this is impacting them, is that this is now causing an increase in the anxiety that they're experiencing, and it's also impacting them physiologically. So we've been receiving a lot of calls from people who were, having difficulty sleeping, who are having difficulty maintaining exercise routines because going out for their daily walk is no longer possible, or engaging, in the yoga that they used to do previously is no longer possible. And all of these things are very important because we know that a lot of these elderly individuals have conditions such as diabetes or hypertension, where maintaining a healthy lifestyle is very critical for their overall well-being. And this is one place where seniors are really struggling a lot. But more directly as an impact on mental health is what the lockdown has meant in terms of social distancing. So for a lot of seniors, even something as small as a daily walk to the grocery store used to be their outlet for socialization, or a trip to a visit to a place of religious worship or other community activities. These would be their social networks and their social lifelines, particularly for those who are living alone. And with the lockdown situation and social distancing, many elderly who were living alone have experienced increased social isolation, and accompanied that are in heightened feelings of loneliness and then helplessness, given that they are not able to understand, and we all don't know when these circumstances are really going to change. And what this really does is make these individuals who are feeling even more lonely right now and more helpless in these circumstances, very vulnerable to mental health conditions such as depression. So it's very, very important that we watch out as mental health professionals for early signs and symptoms of these kind of conditions, so that they can be provided the help and support that they need during these very difficult times. Another area where we found a lot of people struggling is with just heightened anxiety. For many senior citizens, those who are living alone, those who are living with their families, watching the news is the way that they remain connected with the outer world. And a lot of senior citizens take pride in being abreast with the latest current affairs. But unfortunately, right now, there's so much coverage on the COVID pandemic. There's so much depressing news out there about the number of deaths and the fact that seniors are themselves a vulnerable group, that all of this news is incredibly depressing. And what this does is it increases a lot of anxiety amongst senior citizens that we've been seeing. It also increases a lot of fear about them contracting COVID. So even if they are remaining safe within the confines of their home and they're able to get support for their basic needs, we've seen an increasing number of calls and seniors who are now experiencing symptoms of anxiety, but are concerned that these are actually symptoms of COVID or symptoms of an infection, but are concerned that this may be, signs of the COVID infection. And it's important that we reach out to seniors and their families and help them understand what the signs and symptoms of anxiety and panic are and how to deal with this and how to reduce this. So for example, shortness of breath or increased palpitations, which we've had a lot of seniors mentioning that this is what they're experiencing as symptoms, that these are actually signs of anxiety, and really talk to them about how important it is to reduce anxiety and not constantly watch the news or try to reduce worrying about contracting the infection, really reassuring them that if they're following safe practices and guidelines that have been recommended, that's really the best that they can do. Also, most of the seniors that we interact with have experienced some or the other losses in their, throughout their lives. They would have experienced very traumatic experiences, particularly around the partition time. And we found that a lot of these kind of news, these uncertainties, is really resurfacing some of those fears and anxieties again. And it's almost as if they're, they are vulnerable to post-traumatic symptoms under these current circumstances. So it's important that we know about these kind of signs as mental health professionals, help families understand this better, and help support seniors to deal with these symptoms, help them understand, provide them information that's accurate to know what are the early signs of COVID, but also to help them distinguish between the signs that are actually maybe an infection or maybe anxiety symptoms, and help them know that these are things which they should not misinterpret. And then there are a group of senior citizens who may have had a previous mental illness with which they've been coping fairly well, particularly depression and anxiety. We have a lot of clients who've had long-standing history of mental illness, and these current circumstances, we're seeing a lot of relapses or a lot of worsening of symptoms, a lot of families who are panicking about whether they need to, increase medications or how they deal with these symptoms that are resurfacing right now when the particular illness was fairly well controlled for a prolonged period of time prior to this. And again, because the overall public awareness about mental health conditions such as depression and anxiety is very low amongst the general public, there are a lot of individuals who may have an underlying mental illness such as depression, which has not been diagnosed. But now it's becoming more difficult for these seniors to cope with these symptoms, and it's reaching a point of crisis where families are becoming very concerned, hearing their loved ones talk about death constantly, talk in such negative ways, which is impacting their own mental health. And we're hearing a lot more people reach out because to understand why this is happening. And I just wanted to emphasize that it's important to really think about mental health of seniors at this time, because there is a relationship between the body and the mind, and we know that symptoms of anxiety and depression can weaken the immune system. And when seniors are already vulnerable to these infections, in addition to remaining safe, it's very important that we look at supporting their mental health needs at this time so that we can help them remain healthy and support and improve their overall general well-being. But in addition to just supporting the mental health needs of seniors, it's also important to support the mental health needs of family members and caregivers who are also struggling at these times, particularly given the restrictions that the lockdown has in terms of gathering external support. And what we're seeing is that a lot of family members who used to have support from either 12-hour attendants or you know, neighbors and other family members, but are now no longer able to receive that kind of support. We're finding that these family members are now struggling to provide care for those with chronic illness, as well as balancing, you know, work from home, for example, which is becoming a challenge for these individuals. And it's important that for family caregivers, they understand and know what the signs of caregiver stress are and identify when they're reaching a point of burnout, so that they protect themselves from developing mental illnesses themselves, from being susceptible to anxiety and depression, which is what we would want to support them with. In addition, for families who have the support of 24-hour care attendants, which we provide at Samveda, and what we've been seeing is a lot of our care attendants are experiencing challenges themselves, where they're reporting feeling very trapped by the situation. Just knowing that you can go out, you can step out to your family, you know, seek help wherever you want, and knowing that that's not possible under the current circumstances is leading to them feeling very helpless and very trapped. And also we're finding them vacillate between knowing that they're doing something very honorable, very, very worthy of their role as a care attendant at this particular point in time, vacillating between that role and then a lot of guilt about not providing care for their own family, not being there for their own family members at this point in time. And many of their own family members are also struggling at this time. And this is really leading to a lot of concerns and fears about the future with all this uncertainty. So how are we supporting mental health of these various groups of people at this particular time? Well, firstly, if we talk about senior citizens, and I think these are very general kind of pointers that we can all benefit from, the first thing is to remain connected. Social distancing really doesn't mean it's just really physical distancing. It is not emotional distancing. And we've been reaching out to our senior citizens, to caregivers, as well as our care attendants, by constantly remaining in touch with them via phone or other means, you know, video calls, to help them know that we're there, to help them know that we are able to provide support when they need it. The second thing is, which is very important, to prevent any sort of relapse or any sort of other physical health problems, is following a routine. And the routine should involve some pleasurable activities, something other than watching the news or monitoring COVID updates. For those who have family living with them, we're encouraging them to spend time with family members, with grandchildren, doing simple activities, playing games, reading a story, looking at something other than COVID-related news. But also to follow a routine to ensure that sleep, exercise, and diet are maintained and managed well. So it's very, very critical for seniors to maintain sleep hygiene at this particular point in time, and to engage in whatever exercise is possible. Today we had we conducted a session on chair yoga, which is something that a lot of senior citizens, even with mobility restrictions, can manage, and it's important to maintain general physical health as far as possible given the restrictions. In addition to that, for those who are providing care at home, and for family caregivers who have now become primary caregivers, it's important that they understand the signs of feeling burnt out. If they are feeling overwhelmed, if they're feeling constantly anxious, if they're feeling irritable, it's important for them to talk to other family members. If they're alone, talk over the phone, share these concerns. And where it's possible, important to try and share caregiving duties amongst families. We know that this isn't easy. We've been connecting with family caregivers, helping them understand how they can provide care. It is a hard thing to do. But I can't emphasize enough how important it is to also take breaks, for family caregivers, and how important it is for them to prepare for contingencies. This is a situation where a lot of family caregivers are feeling very helpless, feeling very out of control, and therefore it's important for them to try and take stock and be in control of situations where they can. So prepare a routine, try your best to follow that. Prepare for contingencies, understand how you're going to cope with problems if it, if the daily care routine doesn't fall in the way that you have planned it. What would you do? What is your plan B? And also recognize early signs of stress. We've been sharing with our caregivers that if some amount of stress is very natural, it's very normal under these circumstances, but if this persists, if it's impacting your ability to sleep, if you're feeling constantly low over this period of time, it's very important to seek professional support and to understand how a professional can help. Also, for our care attendants, one of the things that we've been doing, which is very important, is acknowledging the support and the role that they're providing at this time. And also encouraging them to keep in touch with family, encouraging them to take their breaks from caregiving, and encouraging and really providing them a lot of reassurance, validating their fears, but as well as helping them understand that the role that they are playing is helping seniors remain safe, and really providing them a lot of acknowledgement for the roles that they're providing. And we found that these are simple things that are helping the care attendants provide care. So also, we've been using technology to remain in touch with our seniors since the outbreak. We've been providing online counseling, online telemedicine support, and helping elderly who are alone and unable to manage grocery, medicine needs, their daily needs. We've been providing support to arrange that online. So these are some of the things that we've been providing and supporting seniors during this COVID pandemic, and ways in which we're really reaching out to the community to help them support their mental health needs from Samvedana. So that's really what I wanted to share, and I'm happy to take any kind of questions.
Great, thank you very much. We do have one question. Let's see. Ganesh Maya would like to talk. Ganesh, I have unmuted you so you can ask your question.
Ganesh, it appears you're still on mute. You might need to unmute from your end.
Okay, so let's go on and answer one of the questions in the chat. So it has kind of come up in a couple different questions, but one of the questions is, how do we address and prevent staff burnout?
I think what we've been doing with our staff is really remaining connected with them, helping them understand, share, validate feelings. That's remaining connected with staff is very important, and I think helping them take breaks from their caregiving duties, helping them to remain in touch with their family members. And voice concerns, share concerns. I think this is a time when we've been there is no one answer to what's the best way to provide support, but knowing that this is a situation which we're all in, and knowing that other staff members are also facing similar concerns has been very reassuring.
Yeah, and just to add to that, you know, we've been trying to really celebrate all the good things that are happening too. You know, we're having community members use like sidewalk chalk to give our staff positive messages and thank yous to our staff. We also have our employee assistance program engaging our staff to address some of those fears, and also that, you know, these folks on the front line are going to be the heroes throughout this whole pandemic. You know, when we look back in history, they're going to be the ones that are saving lives, that are connecting families and patients and making our patients comfortable. So really talking up some of those positive things and some of the ways our communities are coming together to celebrate their hard work and dedication in taking care of our patients.
Thank you. Now we're going to have Dr. Rao speak.
Yeah, can you hear me? I'm Dr. Rao. I practice in Mumbai. I'm a private practitioner, and both the presentations were very nice. And what I wanted to add was Melissa has finally said it in the last few minutes. And yes, we need to celebrate what we have as well. And for the caregivers, I thought we can divide into two aspects. One is caring for self and caring for the people whom they are supposed to care. So they need to take care of themselves over the anxiety and the helplessness, whatever they feel. And also for the care, people whom they care, they can only do whatever they can within their control. They need to understand there are certain situations which are beyond their control, and they need to learn to understand that and accept those limitations as well. I think that would help them to cope up. And as Melissa already said, celebrate the small things as well. Celebrate birthdays, celebrate good things, whatever is happening, and everybody coming together and making a good time out of small things also keeps their morale going up and up and up. It is a tough time for everybody. I think the whole world and all the helping professionals are feeling anxiety and helpless now. Anxiety and helplessness has become pandemic as pandemic as COVID. But we have to keep telling ourselves this time will pass and we are going to come out more resilient and more stronger. So the caregivers keep telling themselves this the time is going to pass and I'm going to get more stronger. I think it will help them to cope better. Any more questions?
Great, thank you. One question that has come through the chat that I find very interesting is when you're talking about social distancing, what do you prefer? Residents meeting each other within the community or maintaining strict social distancing?
I can say from our perspective, you know, maintaining is the social distancing piece is very important. We have centers though that strictly care for patients with memory impairment or dementia. So sometimes having patients stay in their rooms can be a little bit difficult. So, you know, while there's no clear answer to that, we keep telling ourselves, you know, we have to do the best that we can to maintain those precautions. And maybe it's, you know, your patient needs to exude some energy. So maybe it's doing an in-room exercise program so they can burn off some of that energy. Obviously, boredom is a very big piece of this, having our patients sitting in their rooms. So, you know, as much as we can, we want to stick to that social distancing. But obviously there are times where, you know, in the patient's own mental health or psychosocial well-being, getting them out in the sunshine, getting them to see, you know, other, you know, the birds fly, the trees, getting into nature is really helpful. So While we do that, we try to maintain every precaution as you know, our masks and our gloves and our gowns, keeping all of those on. And so you kind of just have to weigh those risks and benefits.
Great, thank you.
I just want to add to that. I think that one of the things that is really important, I know it's so difficult to do right now, is that social distancing piece is really preventing COVID from getting into your buildings or into your centers. So I think that the anxiety around once you have COVID in your buildings is so challenging for family members and for the residents within those centers, that keeping that social distancing, as hard as it is to tell your residents, that you have to maintain that, I think in the long run, it will be more beneficial for your residents and for your family members and for your staff if you can keep COVID out of your buildings. So really, as Melissa said, trying to find other ways to socially engage those residents, whether it be individual activities with a caregiver in those patient rooms, whether it be group Zoom type meetings, whether it be group bingo, right? Or group, some type of group activity where many people can interact together, but still keeping at a social distance.
Yeah, O'Neill, I just wanted to provide a story on that, quick story. We've been having our residents sit in the doorway of their rooms, and we have an activities person, calling bingo. And so while they're still, socially distancing from each other because they're still maintaining that 6 feet apart, they're still interacting with each other while doing something fun. So being creative in that way. We've also, in our residence rooms on their televisions, we've been live broadcasting, whether it's an entertainer, a singer, a movie. We have a channel that we can use that broadcasts into every patient's room. So trying to engage them that way in those types of activities.
Thanks, Melissa.
Thank you. There's another question that came through here, and it says, due to Corona, it is more than the physical, it is mentally disturbing the residents, as every day receiving the messages only on COVID-19 through all the different media channels, such as WhatsApp, social media, newspaper, and TV channels. And there's no other entertainment being shown. Any suggestions on that piece?
So we've been encouraging seniors to limit, looking at social media updates and WhatsApp updates, and really focus on things other than COVID updates. There are there's a number of old movies that have that are available now online. We've been encouraging them to watch some of these things, listening to music from that they're very fond of. We've been encouraging our seniors to make lists of songs that they're fond of, and using a lot of music through the day to keep their mood upbeat. Of course, I mean, I speak from the non-residential the facility perspective, but even in terms of wherever we have seniors living, we've been encouraging them to engage with extended family members, remain connected via phone, and just share movie clippings or YouTube clippings of old movies, sections and things that they may enjoy. So that's some of the kind of ways in which we've been engaging our seniors, and really weaning them off these social media updates and WhatsApp, which can become very, very depressing.
Great, thank you. Another question is, do you think that emotional factors limit rational thinking amongst family members? How do you tell them that they are doing fine and should not feel guilty about something?
Definitely emotional factors can influence rational thinking. We've had calls from family caregivers who are aware that they're becoming very irritable, very angry towards their family members, with dementia, and they're struggling to provide basic care and support for them. So it's important that, so we've been helping them, we've been providing them that listening ear as counselors and mental health professionals to help them understand that if there is a point when they feel that they are not able to deal with the situation, that's a point at which they need to break away from their caregiving role and to focus on themselves. And if they're not able to get that support from within the family, that's the time point at which they need to reach out to a professional who can provide that kind of support, help them understand how to manage that, that anger, that irritability, that reaction to situations which may blow out into an overreaction. And we do have people who express a lot of guilt once those kind of, once they have become irritable or angry at a family member for not doing something. But remaining connected, providing that kind of support for those family members is very, very critical at this time. And again, reinforcing and, kind of helping them understand that they are still doing a great job. And it's important that before they reach that point where they become irritable or angry, that's the point at which they need to stop, take a break, and then return back to that particular duty when their emotions have settled.
Great, thank you. This question is a little bit along the same lines. So to continue with the care plan for people with mental illness is difficult in this scenario. Are you able to continue with psychotherapies, and how are they reacting to it?
So this is something that we're exploring. We're still learning as we're going along, because it's definitely there is a difference between face-to-face interactions and online therapies, particularly for seniors. But we are exploring this. We're learning how seniors. We're first helping seniors become digitally literate. We're first helping them understand how to use a Zoom chat or a WebEx chat, how to make sure that the audio is okay, and how to, how the importance that it doesn't matter even if they can't see us, that we can still hear them, and really understand how we can remain connected. So we're learning along the way, and I think it's interesting to see how how this evolves over the coming weeks, because it's with those who can engage. Definitely online counseling, online therapies can be done, but there are groups of seniors who may struggle with technology. And I think the first step is really to help them understand how to use the technology, and then begin these kind of therapies with them.
Yeah, and for us, in some of our more rural centers, we've been using telemedicine for mental health services for a while. So for some folks, it's not something new. But for us, we had to really prepare in the centers that we're used to having mental health professionals come in to really, designate a person on our side to be that technical support when we're trying to set up telemedicine for mental health, because some of our seniors really don't know how to use an iPad or a laptop. So again, as part of the preparation, who do you have that could be that person that understands the technology and has the patience to work with our seniors in setting up that technology for visits. And in some centers, we're still allowing mental health professionals in, depending on the severity of somebody's illness. So really prioritizing, who a mental health professional would see.
Also, just to add, we've found that where Zoom calls or use of the iPad or a laptop isn't possible, telephone counseling just over a regular phone call that works very effectively. So that's something that we've been doing a lot of, and to remain in touch with seniors.
I think one
Great.
point that I got from both of you a little bit is that really, you know, how we are adjusting our environment and how we are dealing with this new remote world, that it's very important to have somebody in your centers that does have some sort of technical abilities, right? And that how are we going and taking that person or that group of people that have that technical capabilities and bringing that person and that technology to the patient. So the question about thinking about emotional factors and irrational thinking of family members and members feeling family members feeling guilty about not being able to provide that care. How are we utilizing our staff to be able to go in with an iPad and sit with that resident and that staff member and talking with that family together as a group to make that family member feel reassured that we're there as an extension of family, right? So I think that a big role of what our job is now, beyond just the medical capabilities, is really being an extension of family. So making sure that family have confidence in our staff by seeing them on a video call, sitting next to their family member and making sure that they're taken care of. So we have to be an extension of family now. And it's very different than what we always used to do, is we say, oh, the family can handle that, or we can work with the family on that. But we now have to be the family for those residents in our facilities. So again, it's a very different mind shift for all of our staff. And it's very hard in really being able to make sure that we're caring for our staff, because those staff members are caregivers in providing medical care, custodial care, ADLs, and now truly being a family member and being involved with them. So how are we leveraging and teaching our staff to really become that extension of family and using that technology and that video, so even if that resident can't do it themselves, that we're being part of that. So just again, how we're designating certain people within our facilities to really take that role, or even designating them as, you are the family extender, right? And going from resident room to resident room, making sure that those family members are feeling good about being in those buildings.
Yeah, I would just actually like to add something to Neil's point, which actually was very well said. You know, what we're doing, what we have done sort of in the past and what we're doing today may tomorrow become our new normal. And what we have to start looking at is, you know, what will that new normal be? You know, what does it look like after sort of these restrictions are sort of lifted and you know, across the globe? You know, we now need to start thinking about, you know, will this just automatically just go away? Will there be a transition to a lot of this stuff? Will some of the stuff that we're doing today that we put in place be sort of part of our standards of practice, or the way we practice, or the way we provide care? So it's something that, you know, not only what are we doing today, but what are we doing tomorrow, and what will we need to continue to do? Because some of this anxiety and stress and isolation is just not going to go away when some of these restrictions are lifted. So, you know, it's one of the things that we as a company have already started to think about, like, what are we going to do? What are our centers and what are our standards of practice going to look like moving forward once a majority of these restrictions, or some of them, are lifted?
Great, thank you. I think that answered one of our questions up above about who should be the communication person within the company. And then we have one more question here, and it's related to the design of senior living care facilities. So Neil and Dean, you may be able to answer this one. What has been some of the learned things on design considerations of senior living and care centers consequent to COVID-19 pandemic?
Yeah, I think it's still a little early to be able to really sit down and say how would we design buildings differently going forward. I think that as we start to continue through this right now, I think that we're focused on, looking at the buildings that we have and the people in the buildings that work in the facilities and live in the facilities, caring for them. I think that as we progress through this and we look at new design models and look at how we would design things differently, looking at pandemic considerations, I think that will be something that we will focus on going forward. But I think that as of right now, I don't think that we are so focused on building of the new buildings and what that construction would look like and what the design and layouts would be. I do think that will be a consideration as we move forward, but I don't think that we've really learned enough yet. I think it's still too early to say, this is how we would design a building moving forward with the pandemic considerations. I know, some things like, additional PPE, storage areas, things like that, are pretty evident now. But really looking at the full design spectrum, I think that is something that will come in the future.
One of the things that I wanted to add to that, because I do help support the team with some of the environmental things, is not necessarily the design and the layout, as Neil said, that's a much bigger picture, but thinking about the other elements in the environment and the design, the soft features of the design, meaning the surfaces that are placed in the facilities. Obviously, this being a highly contagious virus and all the various ways that it can be transmitted, we really need to consider the types of materials that are being utilized in the facility to help reduce that infection control spread. And, so cloth, making sure that in common areas where residents may touch or be seated, those cloth fibers are non-moisture pooling and can be cleaned and disinfected versus them being fabrics that are very porous that cannot be cleaned and laundered adequately when multiple residents are going to be exposed to them. So those types of soft surfaces, that's one of our practices that we have always done in our facilities, but I think that will take even more priority and emphasis kind of going forward, looking at carpeting and flooring and light switches versus automatic lights that come on when people enter the room. So some of those smaller features are things that we have considered in some of the more recent designs, but I think will be a bigger focus, as Neil said, going forward once we're on the other side of this this pandemic.
Great, thank you. I don't see any more questions coming through.
Great, so Nancy, do you want to close this out?
Sure, I think this has been really, really informative, personally for me as well. I really want to thank everybody. I really want to thank Jayashree and Melissa for taking up time for this. Dr. Rao, thank you very much for jumping in. This was great, and we will see all of you again soon for the next series, next part of our series rather.